womb, so during pregnancy. Now it talked about the placenta and how the fetus is connected to the placenta through the umbilical cord, and that is how the baby gets all of its nourishment, how it gets its oxygen, all of those things. And that leads us to different risk factors that can be involved during pregnancy, and we call those teratogens. And the placenta and the umbilical cord have a crucial role with that, which I'll talk about here in a little bit. So we'll talk about some general risk factors, discuss what teratogens are, and how they influence prenatal development, and then how a baby can be diagnosed before birth in terms of whether or not they have been exposed to a teratogen. So some general risk factors, things that the mother needs to be aware of during her pregnancy is nutrition, stress, and then her age. So just like we need to take care of our bodies at all times and make sure that we're eating healthy, a mother needs to do that while she's pregnant, and that is because she is going to be the primary factor in her baby's development when it comes to the nutrition it gets. So again, we go back to the placenta, the umbilical cord. The baby is getting all of its nutrition from its mother through the placenta, through the umbilical cord. So what the mother is eating and putting into her body, the baby is also being exposed to. So the mother needs to be aware of her nutrition, and she needs to make sure that she's eating healthy, not only for her well-being, but for her baby's well-being. Stress is another thing that a mother needs to be aware of, so making sure that she's not putting herself in stressful situations during her pregnancy, because what happens is there's a decrease in the amount of oxygen that the fetus gets, and two, we know that stress can weaken our immune system. So if a mother is continuously stressed during her pregnancy, her immune system can weaken and she can get sick, and then her baby can be exposed to illnesses that it cannot fight off. So it can be harmful to the baby. And the last one here, a mother's age. She doesn't want to be too young or too old, because if she's too young, her body probably isn't mature enough to fully support and sustain a pregnancy. And then if she's too old, the pregnancy can put a lot of stress on her body, therefore putting stress on the baby as well. So we talked about the timeline of reproduction and reproductive development for a female, and there's that range that is best for a female to reproduce, and that's in her 20s, maybe early 30s. After that, or before that, she can be at risk for difficulties during her pregnancy. So I mentioned the term teratogen. It's kind of a funny word, but a teratogen is anything that can cause an abnormal or harmful effect on the fetus's development. So teratogens are drugs, chemicals, could be an infection that can cause a delay in development, can cause a birth defect, something to go wrong during the pregnancy that will be harmful to the fetus. So there's all different types of teratogens, and about 4 to 5% of birth defects are caused by a teratogen. Other ones are going to be, other birth defects might be caused by like genetics, but 4 to 5%, so not too many, are caused by a teratogen. So something on the outside, an environmental potentially impact on the mother's health that then impacts the baby. Okay, so diseases, drugs, and environmental hazards would be considered teratogens. So again, thinking about that placenta, diseases can pass directly through the placenta to the fetus. So if a female that is pregnant is exposed to a disease or gets sick, that is going to directly have an impact on her fetus as well. Okay, so there are a few different ones, examples. Toxoplasmosis, so that's by, you can get that by consuming uncooked meat or being exposed to cat feces. And then there's rubella, which is like measles, and herpes. So those would all have a negative impact on the fetus if the mother had those things. So I actually know someone who had measles when they were pregnant for or with their daughter, and she now has very, very severe mental and physical disabilities. because the mother was exposed to measles, had measles, therefore the baby was affected by that in a very negative way. Another teratogen could be being exposed to drugs. So it could be cocaine, alcohol, tobacco, even caffeine. So when a mother is pregnant, she needs to watch the amount of caffeine she consumes. Obviously, you don't ever want to be around tobacco, but this can have a poor and negative impact on a fetus's lungs as it develops. So if the mother is exposed to that, or if she smokes during her pregnancy, it's been found that the fetus can have delays in the development of their lungs. A lot of times, mothers who smoke during pregnancy, their babies have asthma and things like that. So tobacco is a drug that a mother would want to stay away from during pregnancy. Alcohol, too, is another one. So I'm sure you've heard of fetal alcohol syndrome. A baby that is exposed to alcohol during pregnancy, during their development in the womb, can have really negative effects from that. So lack in brain development, lack in other development of other body systems. So a mother needs to be cautious about what she's around during her pregnancy. And the last one here, environmental hazards. This can be dangerous because a lot of times we're not aware of the presence of an environmental hazard. So we could be consuming polluted water or being exposed to polluted air, and we don't always realize that we are being exposed to those things. So that can be dangerous because if we're unaware of it, we don't understand or don't realize that our baby is also being exposed to that. So environmental hazards can play a role in the development of a baby as well, and it is considered a teratogen. Some other common teratogens, medications. So prescription drugs. Mothers have to take a certain type of over-the-counter medication when it comes to like pain. So I believe it's only Tylenol that they can take. They can't take things like ibuprofen because it can have a negative impact on the baby. Street drugs, alcohol, tobacco, we talked about those. Viruses and bacteria, so any sort of illness that the mother has during her pregnancy, again, will directly impact her baby because of that placenta and the connection between the mother and the baby. So teratogens are only harmful during certain periods or points of development. So they're not universally harmful. So they'll only harm certain structures or body systems at a certain point in development. And this next slide has a good image to show that. So if we look here, this is the period of the zygote. If a mother is exposed to a teratogen and the developing zygote at this time is exposed, it will likely result in prenatal death. Okay, so that pregnancy will not be viable, that zygote will not develop any further. Now, if we get to the age of the embryo here, so 3 to 8 weeks, this shows what can happen. So major congenital anomalies. So this shows where in the body there could be a defect. So during this 3rd week of pregnancy, the heart can be hurt. The central nervous system can have defects to it. You can see during the 4th week, the eyes, 5th week, heart, eyes, limbs. So if a mother is exposed to any type of teratogen during these weeks of pregnancy, those are the areas that could be impacted within the fetus. You can see as it gets later on in development, so during this fetal period, the brain is a big one that can be impacted. So again, it's not universally harmful, and it's not going to harm the baby as significantly during maybe the last part of development in comparison to this first part. So if a mother is exposed early on, there could be more significant impacts on her fetus or her baby than later on during development. So there's a way that a baby can be diagnosed with some sort of defect or abnormality before it is born. Okay, so we call this prenatal diagnosis. So it's diagnosis before birth. So there's two ways: amniocentesis and chorionic villus sampling. So amniocentesis is where, and you can see amnio, like in amniotic fluid or the amniotic sac, where a sample of the amniotic fluid is taken from around the baby, and it is going to be screened for developmental abnormalities. So they can use part of this fluid that they take, a sample of the fluid, and they can test it to see if there will be any abnormality or defect in that fetus. This other one here, the chorionic villus sampling, this is going to be where they take, it says villi of the chorion, but it's just part of the placenta. So they're taking a sample of tissue from the placenta, and then they will test that to see if there's any sort of abnormality with it. So this image will kind of give you a better picture of how these things are done. So the amniocentesis is where they actually take a hollow needle and they would go through the uterine lining and through the uterus and get a sample of the amniotic fluid. Where the other one, the chorionic villus sampling, they actually take a really long, malleable like tube and needle, and it goes up through the vagina, through the vaginal canal, up through that cervix into the uterus, and they actually take a sample of the placenta that the baby is attached to. So that is done earlier on in pregnancy, where this other one, amniocentesis, could be done a little later on, once that amniotic fluid, the amniotic sac, has been produced around the baby. So those are two ways that abnormalities, birth defects, can be detected before a baby is born. All right, so with that, what I want you to do, because I talked a little bit about teratogens and common teratogens, but I want you to look more into that. So on Canvas, I have some common teratogens and I have articles about them. So you guys are going to do a teratogen summary. So I have these different articles available to you, and they're different teratogens, and it talks about how they impact the mother and the baby during pregnancy. So alcohol, marijuana, tobacco, toxoplasmosis, and then Zika. So you get to choose one of those articles to read, and then you're going to write a summary about what you read. So your summary needs to be about 2 to 3 paragraphs, 5 to 7 sentences per paragraph. And I want you to remember that a summary isn't just copying and pasting or writing word for word what you read. You need to restate key points, put concepts into your own words so that I know that you understand what you read. Okay, so again, you're just choosing one of these. They are common teratogens. Again, a teratogen is just something that can have a negative impact on a baby's development. So whether that's drugs, alcohol, being exposed to a disease or illness, anything like that, that would be a teratogen. So I want you to read more about one of those, and again, you have your choice on that. So that is it for today. Tomorrow we will talk about labor and delivery.